parliament to pass the budget. So it is difficult to attend. The timing is so coincide. So it is difficult to actually in the meeting. So we are expecting to join, but that is not sure. And I request Mallika, please moderate the session, and everyone who will participate in this conference will deliver the very much informative information, which will be very beneficial for all of us. And we are expecting a lot of expert opinion from all of you, and which will be which will be beneficial for all of the country people and all of the global people, and as well as ourselves as well. So I'll request Mallika Mariam. So please moderate the session and continue the session.
Okay. Thanks, Amit. Actually, this whole session has been started by Dr. Ayla, actually, by her Women Leading Change, and I think the intention behind it, which will Dr. Ayla will share it later. The intention behind it is to connect people from different parts of the world and how they are experiencing the COVID-19 during this situation and how they are overcoming challenges, either in the lockdown or in terms of the mental state or in terms of the wellness. So many aspects of being influenced by this COVID-19 situation. So I think we started off from the beginning. I think I think I would say end of March we started this session, and I think by now we have, I think probably the numbers Dr. Ayla will share later. So we have reached out to thousands of people all around the world. So I would say almost 100 countries, yeah, Dr. Ayla, we have reached out. And I think it's an amazing work, a team of people that who have embarked on this journey. So it's an amazing platform. It's called World Women Leading Change, which we started off, but I think it has reached out more than women. People from all walks of life have come through this. So this session we wanted to share, because I think all this time we've been sharing on the business side, on the wellness side, on the different parts of it. So this time we wanted to do something on the public service, because during the lockdown there was a lot of requirement, a lot of stress, and a lot of coordination that needed to be made by the public servants, in terms of ensuring the people's safety, ensuring the people's in terms of coordinating how the measures are taken by the governments, by the policymakers. So we wanted to share this session to really understand from the public servants and how they have gone through it, and what are the measures they have taken and how successful their stories are. So that's what we wanted to do in this session. So having said that, I think everyone's input will really shed some lights, learn from each other's experiences. So that's the whole idea of this conference. So I think without further ado, we can start. Dr. Ayla, do you want to say anything before we start?
First of all, I want to say thank you to Bangladesh, especially Mr. Ahmedul and my president of WWLC Bangladesh, Datin Maliga. Thank you so much for hosting this event, and to all the speakers. I wanted to say thank you for spending the time and making sure that coming to the conference and speak. And this conference is actually batch 22 from World Leadership Conference. Is the initiative from World Women Leading Change. We have reached about 37,000 people now. We have 6 centers. So we actually have conference every other day. The purpose of the conference, it was started during the pandemic to create a vaccine of heart, to create positivity, to network beyond the new world, the world of borderless world. And I welcome you all, and this is batch 22. Bangladesh is hosting, and so far there has been about 360 leaders all around the world, and this conference will be documented by education center to be given to our future generation, like a book of during pandemic, or a book of the new world. We will call it the new world. So thank you very much. Your input and your thought are very, very precious for us. Also your time. And over to you back, Datin Maliga.
Thank you, Ayla. Thank you. Like Ayla mentioned, I think this is an amazing platform. So I think, to start off the session, we start off with the speakers. Thank you so much again. Thank you everyone for joining us today. Amit and I are really happy that all of you are here and to share your experiences. I think our first speaker, Mr. Ridwan Jamaluddin, the Vice Coordinating Minister of Indonesia, is here with us. So without further ado, we will start the session. Just before we go into the session, I would like to say that each speaker is given 5 minutes to speak, and I will usually show something to say that the time is up, and then we continue on to the next speaker. And those who are attending the session will be given 1 minute to speak and share about themselves, what they do and how they have, what are the points that have been taken from this session. So, without delaying, we will welcome Mr. Ridwan Jamaluddin to share a little bit about, on the topic of this session. Mr. Ridwan Jamaluddin, please.
A little bit about Mr. Ridwan Jamaluddin. He is a scientist, actually. He founded Tsunami Buoy, which is a tsunami
early warning system.
Yes, and also he's Vice Minister for Coordinating Minister of 6 Government Minister under Investment and Maritime and Fishery. Over to you, Pak Ridwan. Thank you very much for joining us. I know you are very busy, and over to you, Pak Ridwan.
Thank you very much, Ayla, ladies and gentlemen. Very good afternoon or evening from Jakarta. Sorry for being a little late, just arrived home. Jakarta is now like 55% back to normal condition. But in terms of government effort in managing the COVID-19 problems, a few things I would like to share with you. Number one, that the Indonesian government consider this issue very seriously, considering the size of the country, the large number of population, but we also benefit from the configuration of the country, which is an archipelagic state. So we have many islands that we can pick when we need to isolate a certain group of people. So after the pandemic, the government has established a task force led by a ministerial level official coordinating many other ministers to run the acceleration of this COVID-19 problems in Indonesia. Just a few updates. Since June 7, the government has decided to declare the condition of safe and productive community. So try to balance the management of COVID-19 pandemic issues with recovering social and economic activities. With that, the spirit is to first apply the health protocol strictly, but also open opportunities as far as we can manage to open the opportunities for the public to start their normal life. It's not very easy, especially in big cities like Jakarta and Surabaya and Bandung, if you are familiar with Indonesia. But so far, we managed to balance the condition. However, we are still trying to educate and then to campaign the importance of being strictly followed by the health protocol. By balancing those two issues, we basically allow 11 to 15 sectors to start running back to business. In fact, as of today, June 15, Indonesian government, especially the Jakarta municipality, has allowed shopping malls and some other businesses to reopen their facilities. However, starting today as well, we manage the transportation, especially the public transportation, by managing the demand side. So before, the government always tried to provide adequate public transport, although we try to minimize the mobility, but still there are people need to move from one place to another. There are issues in peak hours, especially in early morning, like from 6 to 8 a.m. and late afternoon, like 5 to 7 p.m. The traffic, the public transport, the commuter train has a lot of issues of social distancing, physical distancing. It's not very easy. The crowd is very large. So starting today, the government has decided to split the working hours into two big groups, hopefully 50 by 50%. One group should start their business from 7 to 7:30 in the morning for 7.5 hours, and the other half should start their businesses between 10 to 10:30 in the morning for 7.5 hours. The effect today is actually quite positive. We didn't see too many issues at the train station, the commuter train station, as well as the traffic in Jakarta is getting like, say, 60% from its normal condition. In our perspective, this could be one of the new normals because, you know, Jakarta with its 11 million people, the traffic is very bad, especially in rush hours. Now, with this new working hours, we are hoping to have less traffic congestion, better air quality by reducing less CO2 emission. And then at the end of the day, we are hoping to have a better life quality in Jakarta. But we should also admit in some locations like East Java, South Sulawesi, and South Kalimantan, the total number of infectious or the contagious are still increasing, especially in Surabaya and in East Java. We're trying very hard to maintain that. I also should mention that the statistic shows there are still increase of numbers in terms of patients, but those numbers are also result of increase in samples, both PCR and rapid tests. As of today, I think we have reached like 14,000 samples per day, with a target of reaching 20,000 samples per day. later on, we are trying to reach 30,000 samples per day. Should also mention that the next step after this pandemic, we would like to start the new life, new normal life by promoting small and medium enterprises, businesses, and also tourism. For example, Bali has become one of the best managed islands or cities. There are patients in Bali, but the number of mortality is very low. And also the community involvement in Bali is very well recognized. So it's not only the government, the traditional community also help the government work hand in hand with the government to maintain the condition in Bali. So that's one of the sides. Other than that, considering the workforce in Indonesia, we are also promoting not to stop the, for example, infrastructure development. What we try to accelerate, but still in the framework of health protocol. So overall, we are okay. We are happy what we have achieved, but we also realize that we still have to work hard to prevent what the so-called second wave to occur in Indonesia. So thank you very much, and also would like to learn from you all. Thank you.
Thank you, Pak Ridwan, for sharing your experiences. I think you have given us a couple of pointers where majority of the governments are also doing similar. I think there are a lot of learnings to learn, to hear from you. And I see some of the points that you brought up is how the community and the government actually can work together to fight or to take measures against COVID-19. You're talking about the second phase. So I think that's an important part. I think many countries that have gone through that process and working together have realized that better results through doing that. And in great measures has been taken by Indonesia. Really, thank you for sharing your input and your measures that you have taken in Indonesia. Thank you so much. We'll move on to the second speaker. We have Amit. Do we have Mr. Zunaid Amit from Bangladesh?
I think I'm afraid he is still not able to connect us. As I mentioned you, that they all are in the parliament for passing the budget for this year.
Okay. All right. So I think the Bahrain ambassador is also not here. I did not see her here. I will message her. So we will move on to the fourth speaker, Rajesh K. Mr. Rajesh K. from National Council Member Youth for Seva. Mr. Rajesh K., if you could like to share with us your measures and your input on this conference.
Thank you very much. My greetings from India, and I'm so happy to hear the inputs which were given. The situation, like Ahmadul was telling, in India also it's same. Actually, with after a few lockdowns, of course, things have come in under control. And maybe overall, if you see the situation from responding to the corona crisis that we had, now we are recovering from it. And the rest phase will be, of course, thriving. So I will talk on behalf of the civil societies. I am mostly connected with them. So most of the things are happening is, maybe as I can give an example, that many of the officials and collaboration between the people has been increased. All this year, what actually the governments wanted to bring people closer to the government. In democracy, as they say, that government is of the people, for the people, and by the people. And this overall situation which came, it brought many people together. And then they were actually helping each other. For example, if I could give, there is a member of parliament from our own area who created his own Corona task force, where about 3,000 volunteers were helping people in maybe delivering food, or maybe delivering medicines, or it could be there was also a task force from the government which showed that Corona warriors who were just putting an eye on what are those messages that are coming. See, we are very sure that even when guided by data, some decisions are also involve some uncertainties, etc. So the government utilized the people partnership in knowing that actual communication is well, and maybe if somebody has to travel from one city to the other, so giving them permissions, etc. On the other side, being an IT hub from Bangalore, where I belong, many of the companies have allowed their employees to work from home. So a lot of companies, etc., have allowed, and in some cases, they have told that maybe till September you need not come. As we are aware that schools are closed, and social distancing norm has been very well taken care by the local governments also, and also with the help of people. Maybe in big apartments, etc., in those containment areas, new rules and regulations have been put forward. On the other side, if I would like to tell about testings, etc., so India is coping up with, because a lot of lack of resources are also there when it comes to testing. Apart from this, the government also has come out with an app which is keeping you informed of about your, or not only your health, which is called an Arogya Setu app, but also in the area around that you are there, where you can find out where the people are infected are there, and where that such corona affected people are there, so you can avoid those diseases. They have also allowed the small industries to start with a limit. Restaurants are open with proper social distancing norm, etc. And at the same time, the public transport has been open for people to travel, but there has been some restrictions that there should be proper social distancing and not more than an actual figure of the seated capacity of the buses, etc., are stipulated. What actually is very, what I say, builds confidence in people here right now is that each and every government official who people had a different opinion that they are only bothered about their work, or maybe they are very selfish in nature sometimes, that one, we have that mindset in people that has been broken, and that this has brought societies closer, people more responsible. And in the coming time, I'm sure that things will get better in India, and India can also open up for the other world.
Okay, thank you so much, Mr. Rajesh. I think you mentioned a lot about communities working together and individuals. Even it doesn't need to be just public servants. I think even individuals, the civilians, can actually help. The governments to take measures and help the governments to fight this pandemic that we have. Thank you so much for sharing your experiences and your take on this. I think we will move on to the next speaker, which is Surani Amarasinghe from Sri Lanka. She is the head of human resources of Lion Brewery. Do we have Surani? Yes.
I'm here. Hi. Okay, first and foremost, thank you very much for the invite. It was quite a pleasure for me actually to listen to most of you speaking about what you have been doing in your respective countries. During my session, I would actually like to take a look at it slightly differently. As a country, we went into lockdown quite early on in March. All organizations as well as schools complete lockdown, and the country for all purposes were run like a military, for all purposes, with a lot of advice obtained from the government medical associations and the respective professionals in the medical field. The positivity of it was, of course, we managed to contain the spread of COVID with a very limited number of deaths so far. We have also, as a country, started opening up. Majority of the sectors have opened up 100%, and the plan is to open up the schools to commence as early as beginning of July, with advanced level examinations starting in September this year, because usually August is a big year with university entrance examinations, and the impact to youth has been felt quite extensively. So the positivity is that yes, we are looking at opening up the schooling system so that we are hoping to be back on track. The slight deviation, of course, where I would like to touch on is the impact it has had on our corporate sector as well as our economy. Sri Lanka was totally dependent on funding from our workers in foreign nations as well as our garment industry and tourism. And all of a sudden, we lost three main areas of revenue generation as a country. And for us, it was all of a sudden here with such economic impacts is how do we get this country back on track? A lot of our industries that did cater to all the brands, the garment industry, the brands that were servicing Europe and US have actually started looking at different products. Our manufacturers are looking at health and safety equipment, health and safety attire to see how best we could generate that revenue. The tourism sector, like I said, is one of our largest sectors, and that does not only bring in foreign revenues to the country, but it also employs a lot of people within our rural communities. So it's not just the five-star hotels that's in the cities and so on. In some areas of Sri Lanka, the whole village actually depends on the tourism sector. Unfortunately, that has been hit quite badly. But I guess we as Sri Lankans tend to be quite resilient, and the last couple of weeks, we have seen an influx of local tourists going into some of these areas to try and actually, I guess, get out of this lockdown situation, at the same time start generating the revenues that's required. We are expected to open the airport by the beginning of August, and we're also looking at opening up hotels for tourist arrivals from August. Of course, this is something that we would like to do, but the difficulty would be how are we going to manage the logistics behind it? How are we going to ensure that infected individuals are not coming into the country? So those logistics are still required ironing out. But in general, we're trying to get, as a country, we're actually trying to now get our economy back up and running. It was a good point that the gentleman from India mentioned. Sri Lanka also couldn't afford only to depend on the government to facilitate a recovery or facilitate the information or facilitate the health aspects of it and communication that was required to get through this difficult period. And a lot of the corporate sectors and the private sectors did end up taking charge of whether it was distribution of aid to the rural populations, whether it is to communicate, because the biggest issue was basic communication. How do we inform our masses that, listen, it's not going to be the same about going to a market? So a lot of that communication aspect has been taken over the private sector. A lot, as I said, needs to be done. But I think together with both the government and the private sector, we do hope to see Sri Lanka back on track within the next 3 to 6 months.
Thank you so much, Surani. I think all of us are on the same page. The countries that have went through the lockdown quickly, at the beginning were able to recover much faster. I think majority of the, like what you shared, majority of the countries are also, in terms of the tourism, they were badly hit. And I completely get where you're coming from. And I think many of the countries who are dependent on tourism are, you know, trying to open up and, you know, encouraging more domestic tourism rather than, you know, international tourism. Thank you so much for sharing your point of view in terms of the industries that are impacted. Thank you. And we will move on to the next speaker. Do we have the previous speakers here? I see I think the other two speakers are not here yet. So we will move on to, okay. Ayla has something to say. We have Yusuf. Okay. Okay, I have next speaker, Mr. Yusuf Gairat from Afghanistan, creator of Narfax, as the next speaker. Yusuf?
Yes, hello to everybody.
Hi, would you like to share your part of the talk? Thank you.
Yes. First of all, thank you for inviting me to have a speech. Let me introduce myself a bit. Yeah, I'm from Afghanistan, but in Narfix, we are a young developer teams. We based in Indonesia, and at Narfix, we highly we highly trust on the power of innovation. And I think during the pandemic, in innovations, especially like artificial intelligence, showed themselves like one of the solution for fight the pandemic. A good example is in China. China is one of the forward company in fintech, and as most of people's life banking and lifestyles, it's based on those handphones that become really easily to controlling the cases of coronavirus. And in here in Indonesia, actually, we are trying to build such a system, because now by everywhere has those cameras, and now it can be very easily to find the symptoms and the change on people's health and body before the symptoms of viruses come up. Uh, most of many of apps which were built for lifestyle and for living, let's say like to detecting heart rate or temperature of body, now it's really useful for finding the cases on pandemic. So I think until we don't have the vaccines from the coronavirus, many countries can develop such systems as in China, and it can affect much more than lockdowns, because as we know, the lockdown is also effect on the economic situation in the country. And yeah, we are in Narfix, we are really open mind to build such system. And I hope with Dr. Ayla, we will build and develop such a system really nearly future. And maybe on the next session, we can also share what we have done and what we will build in nearly future. So thank you so much.
Thank you, Yusuf. Thank you for sharing your side of the story. And I think these are the times during, you know, I mean, I'm not saying what happened is a good thing, but sometimes we need to find opportunities at the time of, you know, such situation that we are going through. And people like you are the ones who come up with innovative way of doing things, innovative solutions to the problems that we face. Thank you so much for sharing your thoughts behind it. I would like to go on to our next speaker. was Dr. T.N. Lokesh from India, and he is the professor for NMKRV. Dr. Lokesh.
Namaste.
Namaste.
Namaste, India. Namaste, Bangladesh. Good evening to everybody. This is Dr. T.N. Lokesh, Professor in MKRV College for Women, Bangalore. Indeed, it gives me a great pleasure in sharing my viewpoints about emphasis on citizen safety and measures during COVID-19 in this great international platform of World Leadership Conference. As we all know that right now, the whole world is experiencing COVID-19 pandemic. This is one of the unexpected challenges that threatens our way of life, livelihood, and peace of mind. Despite to the fact that our nation has geared up to combat with the COVID-19 pandemic very successfully and diligently in comparison with other European countries. In Indian context, under the dynamic leadership of our Honorable Prime Minister, Prime Minister Sri Narendra Modi, the 1.3 billion Indians put in collective effort to cut the chain of pandemic and successfully flatten the curve by imposing proactive measures in line with global approaches and guidelines from government. These development once again proves the fact that as is the leader, so is the citizen. As is the leader, so is the citizen. Nationwide, 5 phases of lockdown was implemented to ensure citizens' safety. Right now, we are already surpassing 4 stages, successful 4 stages of lockdown. Right now, the lockdown is restricted only to the containment zone. The lockdown, the first phase of lockdown in India was started 25th March 2020. For 21 days, 19 days, 14 days, it goes like that. This is how the Indians showed their unifying spirit in combat COVID-19 and set an exemplary act of citizenship responsibility. During the lockdown, work from the home has been strictly followed, or the split team arrangement has made. And also the online teaching learning process has been conducted by the colleges, university, and others. And also the restriction on business travel has been imposed to check this pandemic contagious. In all these days, health workers, doctors, nurses, technical staff kept medical system functioning. Police were dedicate their unparalleled service for the public, and all these were rightly called COVID warriors in India. It seems not less than a war. It seems not less than a war in Indian context. In this junction, I remembered a saying that the hands that serves humanity are a lot better than lips that talks divinity. That's why it is very important for us as citizens to protect the country, the nation. With all these things, the cultural and spiritual heritage that prevails in India made us to fight against COVID-19 positively. And also, it is very easy for us to come out from this crisis. The same thing has been told by Lord Sri Krishna at Bhagavad Gita. Be a part of the solution, not a problem. Being Indians, we try to be part of the solution rather than part of the problem. That is how we succeed in fighting against the COVID-19. And also, if you look into the Indian context, we really supported mentally strong by great scriptures, which were given by many great personalities. I would like to quote Swami Vivekananda's saying, the sacrifice and service are the two important core values which influenced the Indian way of life, as once again proved during the pandemic situation. Apart from the government, many more non-government organizations have joined their hands in fight against COVID-Corona. To mention very important thing, one of the world's largest organization, Rashtriya Swayamsevak Sangh, RSS, has done a tremendous work in this direction. Because of the COVID-19, the government of India has taken several steps and measures. Arogya Setu, one of the important mobile application, has been launched to educate the citizens about safety. Set up a chain of 20 lakh retail shops across India. In the nook and corner of India, they are called as the Suraksha stores to distribute the daily essentials. And also the Ministry of Human Resource Development launched the web portal to monitor and record the initiatives to combat COVID-19 with knowledge, technology, and innovation. Rupees 13,855 crores towards farmers under Prime Minister Kisan Yojana has been distributed. Medical insurance up to 50 lakh per person was given to the health worker. They really works a lot with in fighting against this COVID. With all this development, many more leaders across the world praise the Indian government. To quote one or two things, philanthropist and Microsoft co-founder Bill Gates appreciated the Indian PM Narendra Modi for his proactive measures in checking COVID-19 pandemic. The World Health Organization praised and lauded Indian government initiatives in combat COVID-19 and requested India to lead the world with this aspect. All world leaders praised the governance for its effective fight against Corona pandemic. As a result, today whole world is looking up to India as a world leader. Ladies and gentlemen, this is how my country showed confident and matured leadership. That it led me to remember a quote which goes like this: where there is a vision, people flourish. Where there is a vision, people flourish. Where there is no vision, people perish. I am immensely proud about my country, and thanks for the organizing committee for providing me this great and wonderful opportunity. Let whole world will be happy. Thank you. Namaste.
Wow. Thank you so much, Dr. Lokesh. I think you had an amazing sharing. I think it's, again, you know, where the government has to work with the people to ensure the pandemic or whatever situation that we have come through, it's done together, collaboratively. And if you can do it collaboratively, I think that any sort of solution can be reached. And again, I think you also mentioned leadership. When it comes to leadership, the leadership has to also show the right amount of qualities so that people can follow. So great sharing. Thank you so much for the input that you have given. I think we'll move on to the next speaker. This is Mrs. Chandi Aljufrie Dilwala from Sri Lanka, and she is the Global Goodwill Ambassador and also Mrs. International Pageant 2016. I would like to invite Mrs. Chandi Aljufrie. Sorry if I'm mispronouncing your name. I'm not very familiar with it. Please introduce yourself and share your
Right, hello. Yes, I think I can hear you.
We can hear you, please.
Okay, fine, fantastic. Good evening to everyone, and thank you so much for having me on this platform. So I think everyone has been speaking about what's happening with the government. What we have to understand is that COVID-19 is now creating the world, right? They're creating the rules and regulations for the future, and it's a ruthless killer for human power. With right, and I think Miss Surani Amaris has happened in Sri Lanka, so I don't think I need to elaborate again what measures we have taken. And need to concentrate, which I don't know has been touched, is the something that I've heard, the COVID, Corona depression, something like that, which is going on. So I think that is something that we all need to concentrate, because of this virus, we have to actually distance ourselves physically from each other, right? And then the great connection between human has been distant, so that we have been isolated. Whole world has been isolated. So I think at a time like this, I would speak in a different form, because we all know how the countries have been taken measures to rectify this problem. But I would like to say something. We've taken measures to economically support countries, to in infrastructure, in all forms. But have we also taken into consideration the psychological effect we are all going through because of this. I think that is something very important because in Sri Lanka, we have actually created this platform where we um, have been giving psychological support to, especially to mothers, through actually it's a free consultation which is going on in Sri Lanka. I think it's been helping a lot at a time like this to a lot of people, not just to mothers, to anyone, because I think very recently, in a day ago, I think I've heard an Indian movie star had been, a devastating news where he has taken his life. We don't know the reason behind it, but I think the psychological support to have this balance in your life is very important at a time like this. So, with all the measures has been taken around the world to fight against this virus, I think everyone has to think about how we as a human or an individually, how we can support ourselves and support other person, because being isolated, because we've been people who has this human connection on a daily basis, and to have it cut down at a time like this within minutes, and to be isolated into your own little space, you've been fenced and cornered at a time like this, is a time where you will be psychologically affected from everything. Your finance, your mentality, your families, your workforce, everything comes as a force that probably we will not be able to tackle all this, where we our maybe create an imbalance in us. So as I said, we have taken measures to speak to a lot of people uh, through this way conversation through Zoom. But this is not a very economical way in a country like ours, because we don't have access to these things. So we have been connected throughout the country through the phone, and we have been talking to a lot of people who's going through personal issues, and how we could help, how we can actually be able to get the aid to the correct people, because sometimes these aids has not been really gone to the people who really need it, because sometimes the people who is depending on daily wages, they have not have any access to getting anything for their day-to-day expenses. So I suppose these things, the little things that matters a lot at a time like this. So I think I don't know how the world has been tackling this issue, but I think being a small country with very limited resources at a time like this, I think we've tackled this problem quite well. And I think this has been a great opportunity in disguise for all of us to follow the rules that set by itself, and being able to connect really humanly with each other, build the relationship more than and at a time I think we realize the technology and all that is there, but that the human connection is more important at a time like this, because that's the only way that the people have helped each other. And I suppose we've tackled more in this way, especially we've looked into many different ways. Like, I don't know as a government that they have looked into the psychological support, but as organizations we have looked into that as well in Sri Lanka. So I don't know, it's not in large scale, but um, in some ways I think we have looked into that, and we've supported a lot of people to come out of a lot of pressure that they've been having inside them. So I guess that has been something that we have to be proud of. So I guess since Ms. Surani from Sri Lanka has spoken a lot about how government and the rest of the country has tackled this, I suppose this is what I could just contribute as because I think if this has not been something that other countries has not taken to consideration. I think it's very important if we think about how we can really psychologically support, and that kind of wellness is very important. So I think that's something to think about. So I guess that's my contribution to this, and thank you.
Okay, thank you, Mrs. Chandi Vihara,
Yeah.
for sharing. I think Pak Rizwan is still there. I see him logged on. Um, if if anyone has any questions, I would like to maybe invite Pak Rizwan to share. If you have any questions, I think maybe we can take some questions, because he has shared some comprehensive insights into what the government of Indonesia is doing. Maybe we can invite him to answer some of the questions any one of you have. I would like to invite him. Pak Ridwan?
Yeah, I'm still here, but sorry for missing some parts of your discussion. Well, it's not very easy for me to manage time at this period of time. So
again, our thank you to you, for being here and sharing your initiatives and your measures that you are doing with the government. I think we have some, some of us have some questions we would like to ask you, and how, maybe I will start with the first question, because you mentioned that some part of Indonesia you were able to take measures and get results at much faster rates, and you were saying that at some clusters that you are still having an increase of cases. Now, what do you think is causing that, and what the measures that Indonesian government is taking to overcome those?
all right, not very easy actually. Number one is testing, trying to get as many as possible population to be tested. That's to prevent the disease to be spread wider. To increase the number of testing for the size of Indonesia, then we have to provide the infrastructure, the human resources, as well as to educate ordinary people so they are willing to be tested. That's not very easy. Second, we also need to balance the available health infrastructure with the number of patients, because according to the expert, the key is to not to to provide adequate health facilities so that we can take care of the patient. That's the key. For example, now in Jakarta and some other big cities in Indonesia, the bed occupation ratio in the hospital is about 46%, which is good, because at the beginning we were overloaded, but now we can manage to reduce that. But then we manage the transportation, as I mentioned, because according to the survey in Indonesia, the transmission of the virus is like 80% because of the mobility of the people. So we really work hard in the transportation sector. Even during after the fasting month, the celebration after the fasting month, the Idul Fitri, if you are familiar with that, in Indonesia, a lot of people actually come back home to their hometown. It was very difficult for us to maintain, because culturally, everybody would like to go home. Everybody would like to get together with their family. So we managed that. We actually reduced the number of mobility up to only 15% to 20% or so compared to the normal mobility during that period of time. But the bottom line, I think, is to build awareness to the community, and also to educate them to follow the government program. Because from the scientific, technical point of view, the government as well as the private sectors, communities have done close enough to good. I mean, it's almost there, but then we have to balance that with the discipline of the ordinary people in, for example, in traditional market, in shopping mall. Schools are still closed in Indonesia these days. We still have to prevent school children from being infected. So schools are still closed, but important businesses are now open with 50% capacity, only 50% capacity at the maximum. So again, the triple helix approach by the government, so government, private sector, as well as the community, work good enough so far with the leadership of course, of the President Joko Widodo doing that. So that's what I can share with you more on that.
Thank you. Thank you so much for that sharing. Anyone else have any questions? So I assume everybody wanted to either ask the same questions or they don't have any. You have explained it comprehensively, everybody understood.
Wow. So, thank you for that.
I want to ask Pak Ridwan, how about the reopening of the Indonesian tourism and investment, Pak? Because, you know, I'm in the real estate sector and it's a very difficult time for me because I have like, you know, little, you know, little resort in Bali and in some part area.
There's no tough issues actually on investment. We are still open on that, but still to balance that with the health protocol for the actual physical activities. For example, there are discussion to relocate U.S. industries, factories from China to Indonesia. We still work on that. So it's just like a normal process. The only difference is that we don't get together physically, but we communicate through this video conference meet. Other than that, as I mentioned, Indonesian government has been very active to promote, to accelerate actually the social and economic activities to recover the growth. As I mentioned, it's very difficult for ordinary people in Indonesia. Most of them don't have, well, I should say, yeah, some of them don't have like permanent jobs at office. Some of them are like from informal sector. They really need to have this social and economic activity get back to normal. So there's no issue on investment activities and discussing about the economic and industrial activities and that. Tourism is good. Tourism is I should say one of the first sectors to be reopened as a normal activity. Ibu Ayla.
Thank you, Pak Ridwan.
Yeah.
Okay, so do we have any other questions?
Yeah, can I have one question for Pak Ridwan?
Yes, please, Vipra.
Okay, so Pak Ridwan, as you may aware that as of now, there are many companies already like lay off some of the employee because of the business impact due to pandemic, not only for Indonesia but also globally. Yeah. So how do you think this situation going to happen in the next couple of months? Is there any measurement or any initiative from a government to anticipate that kind of like trend in the near future?
Well, basically, I think if I'm not mistaken, like almost 2 weeks ago, the central government offered to local government, the district government, to consider of relaxing the social restriction for certain sectors. 3 or 4 sectors I remember: mining, plantation, industrial estate. Yeah, those are the three priority sectors. The central government offered the district government to reopen their businesses. Other than that, small and medium enterprises have been promoted to start their business, and then in the near future, as I mentioned, tourism will be among the first sector to be re-promoted for that. And we have actually prepared Bali, Labuan Bajo, and some other tourist destination to receive tourists. But again, for the case of Bali, we work very hard to keep Bali in a good shape. We also have zonation for districts in Indonesia based on district. There are red zone, orange zone, yellow zone, and green zone. So we have promoted the green zone and the yellow zone to consider to reopen their businesses, of course, with in line with the health protocol.
Okay. Thank you.
Thank you so much, Pak Ridwan. I think we have taken a lot of your time, and you have really had the patience to explain to us.
Happy to share it.
Thank you so much. Does anybody else who have questions, or we can move on? Yeah. Okay. So
if I may leave, I think I have another parallel session to attend. So thank you very much for having me, and good luck for all your activities.
Thank you. Thank you for being with us, and really appreciate your time.
Ridwan,
thank you so much, Pak Ridwan.
I really appreciate of your joining to this session. This is Ahmedul Islam from Bangladesh. Actually, we are following your country as because you have a lot of success case to minimize the COVID success case. And I will convey your message to our minister, honorable minister, and definitely if anything need, inshallah we will cooperate each other. Thank you very much for joining us.
Thank you very much. Appreciate that. Please my regard to your minister. Thank you very much.
Okay.
Pak Ridwan, thank you so much.
Thank you.
I will.
Terima
Thank you,
kasih, Pak
everybody.
Ridwan.
Thank you.
Thank you. Assalamualaikum.
Waalaikumsalam.
Thank you so much.
Thank you for waiting. Thank you for those who have asked questions. I think we'll move on to the next speaker, Puan Wibra Bihara from Indonesia. She's an executive coach, leadership trainer, and an NLP and mindfulness certified trainer and group team coach. She has, I think, full of accolades behind her, and it will be great to hear from her and her take on the the measures for COVID-19. Puan Wibra.
Hello everyone, good afternoon, and thank you for the time for me to speak, and thank you for Ms. Ayla to invite me into this platform. So basically, let me introduce myself. Actually now I'm working pretty much as a like independent trainer and coach. You already mentioned it, but before I spent like 20 years in a corporate. So my last position is HR director in Adidas for South Asia. So basically in my portfolio before there is Bangladesh, India, Pakistan, and also like Southeast Asia. So basically I'm glad to see you all because this is the region that close to my heart. Yeah. So let me share with you what we've done during this COVID-19, especially in the community of a coach and trainer. Yeah? So I've been working together with a lot of business owner, a lot of leaders, yeah, in navigate the situation, and we pretty much witness, yeah, there is a significant impact to some of those leaders, especially they are the one who in the middle, medium-sized enterprises, yeah. Some of them are really struggling to really like succeed, like to pass this pandemic, yeah. And but also at the same time, we also witness some of the, you know, resilient and creativity along the way. I think Dr. Locke has already said it, that people who has a vision actually will flourish, yeah. And this is actually happen in the ground. So those leaders who has a vision in terms of seeing the opportunity in this COVID, they are able to find a way to really like basically overcome the situation. Some of them really like moving their business, for example, from a garment of fashion to like mass kind of like production or garment. And some of them, like in tourism, they pretty much close their business and they have a lot of employees that they need to still pay for the salary, but they are able to basically change the way they run a business, yeah. And instead of paying a fixed salary, for example, and giving some of like part of the fixed salary and the other salary is like variable, if the employee can bring a business during this crisis, then there will be part of compensation toward to those employees, yeah. So I found that this combination of resilient, which then come up with the creativity, is something which we see as part of the success to like facing this pandemic. So in a nutshell, there are three things that I've been saying as part of a way to navigate the situation. One is how you manage the change, because basically we cannot avoid something need to be changed in the ground. And the second one, how you are building the resilience inside. So I found that people who can see this crisis in the different way than people who feel that it's more like a hit, instead of you just need to face it and overcome it. So it's very critical factor to be successful, yeah, for those leaders. And then also how you build the leadership capability in everyone. So when we are talking about leadership capability, we are not talking about only like leading people, but how you lead yourself, how you become a role model in dealing with such situation. Because we cannot basically avoid that. In some cases, it's really about survival. It's about ensure that you still can live, yeah, for another day, yeah. While some people maybe is different, but I guess this is where the time I can see that both people who has a, you know, the rich kind of category and the one who poor actually facing the same challenges, yeah. So in a nutshell, I've found that this is the era where this leadership quality is being tested, and how we as a community, as an individual, contribute to that matter, yeah. How we build this leadership capability in everyone. So I guess that's pretty much that I can share from my part. So if you have any more questions, feel free. Thank you.
Thank you, Puan Vibra. Thank you so much for sharing. I think you nailed the point in terms of leadership. You nailed the point in terms of how leaders in these difficult times they change their strategies to take care of themselves, at the same time take care of their employees, and rather than just focusing on the negativity, but how do we change business strategies to accommodate the challenges that they are facing. I think that was a great sharing. Thank you so much. And I think a lot of, like you said, there's a lot of SMEs are facing similar challenges in different various industries, and how they overcome is a lot to do with leadership in that level. Thank you so much for sharing your take on this on the business level. Let's move on to the second, the following speaker. We have Swarup Roy. Is he here? I don't see him. And then we have Dr. Ogbanga from Africa. Do we have him here? I don't see his name here. And then we'll go to the next person is Ram Mamidana from India, the Chief Technology Officer at Walden Technologies. Welcome, Ram, and yes, please share your thoughts and your topic today. Thank you.
Hello, everyone. First of all, thank you very much for giving me this opportunity to be part of this wonderful conference. Many people have spoken. I obviously can't match up to their level of experience and expertise of their individual fields. So I'll try and keep my address to the focus area of what we have gone through being a technology company. India has changed. A lot of things have changed. Personally, lives have changed. I, for example, have realized that I can live without a haircut. I've realized that my wife makes a better sambar than I can. So a lot of these things we have learned as a result of this whole lockdown. And they say never let a good crisis go to waste. And that is happening now. The world over, COVID is a reality. Unfortunate that a lot of people have lost their lives and a lot of people are still struggling. But in a way, it has reset what we believed, or what we always believed was the balance of life and balance of power. It has readjusted what nature can do versus what we as humans would be doing. So we've seen a lot of increase in activity in terms of people now coming out of the IT sector because of various slowdowns in the US. And that has led to a lot of startups popping up, a lot of new technologies coming up. A lot of partnerships coming up, like Apple and Google partnering together for contact tracing applications and things like that have started now. We've got virtual meeting room applications. Zoom has increased its balance sheets by a whopping 600 million, which stands testament to the fact that people have realized that they don't need to physically go to meeting, and they can actually be safe wherever they are. And that has now resulted in reassessing the whole workspace model with companies like WeWork, for example, pulling out from 3 different countries where they were supposed to open up co-working spaces. It has seen an increase in the number of architecture companies that are now specializing in no contact spaces. And it has increased the number of companies that are building contactless doors, where you just walk by and using facial recognition technology, the doors automatically open. You don't need to touch, you don't need to swipe, no fingerprints, no iris scans, nothing. So a lot of things have changed, which basically means the world will never be the same again. In a recent survey by Fortune, the Fortune 500 CEOs, 26% of CEOs said that their workplaces will never be the same again. So we forever live in a post-COVID world, where it was a pre-COVID world before. So opportunities abound, challenges abound, and I'm glad to see that a lot of countries have responded positively to those challenges, especially this part of the world, which has traditionally been seen as a developing world, in double quotes, has actually shown the developed world how it is done. And that has been really heartwarming and also very, very enabling. And that true revolution is also taking shape in a lot of other areas, like, in the virtual travel domain, virtual meeting domain, augmented reality domain, and not to mention mobility and e-banking and blockchains and all of those things. So with all of that said, I think there are still a lot more challenges. People need to reassess and re-understand a lot of these things. The lockdown unfortunately resulted in a steep increase in the number of domestic violence cases, which is a bane of many developing countries, especially In India, we have seen a massive increase in, they're going up by almost like 18 to 20% on a daily basis, the number of domestic violence cases, which is a shame as we are in 2020 and things have not yet changed. And hopefully the Black Lives Matter will also make other movements possible. And hopefully we'll see a better tomorrow after COVID. Now, I would just like to conclude and say that the Chinese curse has actually come true. We do live in interesting times. And let's see what the future holds. But thank you so much again for giving me this opportunity to talk to this forum. Some of you guys I've met when we were in Bangalore. And so it's good to see you guys again, and great to be a part of this. Thank you so much.
Thank you, Ron. Thank you for sharing your take on this. I think the technology is definitely has changed the way we do things, and then coming up with new ways of doing things. I think all of us have to embrace that, and moving forward there is a lot of new norms people have to adopt. Thank you so much. I think we'll move on to the next speaker from our list is Dr.
Maliga, the last you were looking for our guest from Nigeria. Her name was really difficult to pronounce, but she's here as a Mina CDC INC.
Okay, and
Mina,
who was there? Was it Dr.
Mina? Okay, please proceed. Let me know.
Okay. Okay, so we have our following speaker is Dr. Debrina Devi Lumanov. Do we have her? I don't see a name here. Physician at Jakarta COVID-19 Emergency Hospital. Okay. Do we have Swarup Roy from Thailand? No.
Amanda, can you help me contacted the person? Maybe they are not, the link or whatever.
Yes, I don't think they will be joining us today.
Oh, they already tell you?
Yeah, sorry about it.
Okay, okay.
Okay.
Okay, Datin Malin.
I think my Her Excellency Maram is also not joining. She informed me just now. I think she has another emergency that she needs to attend to. Amit is your minister. Mr. Zunaid Ahmed is joining. Amit? I think he has gone. Amit. Okay. Well, we'll move on. So I think there was another person, Mina Sitsi, he was mentioning. Okay. I think all of us have spoken. I have someone called Eco. Let's move on to the attendees then. Amit? Okay, let's move on to the attendees. Do I have, I think I have someone called Eco Stiawan. Eco Stiawan. Well, I'm not getting any feedback from that. What about Mina Setsi? Okay. I think probably they are away from the desk. Amit? I see him moving, but okay. So, well, I think we have come to the end of the session. We have come to the end of session, and I would like to thank everyone again for being here and joining us in this platform. And sharing your inputs as well as, listening to the rest of the speakers. Thank you so much. And I would like to invite the host and Dr. Ayla after that to share your closing remarks before we close this conference. Ahmed?
I think that was wonderful of your moderation. So let's put our hands together to achieve, to beat the corona. All the government has doing a lot of things. Same as Bangladesh here doing. Bangladesh has two type of contact center. One is for the for the emergency service, and another is for the information service. All the contact tracing are happening here. Our public transport and all those things are maintaining in a regular way, so that we can save our lives. I think all the measures are also taking all the governments in every country, because people's safety is the first. So people's safety is the first. So everyone taking all the measures, and especially I know in Bangladesh that Bangladesh also tracking government from the government side, and they are doing it very efficiently. They have very innovative applications. Government here every day they are inventing a new process to looking the new identifying the systems. And also I think one thing we might be saying that as we are saying that frontliner is the doctors and the police and military, all are frontliners. We must respect them, as well as IT professionals is also the frontliner, because if IT is not there, so all the services could not be happen nowadays. So we must also acknowledge those IT professionals who are maintaining the servers, connections, internet, and the emergency service like call centers and others. So by this, we are getting all the information and taking all the measures. And today also Bangladesh has, we did this 38. And yesterday it was more than 40. So we are losing our valuable lives. Yesterday we lost one of our cabinet minister, and ex-mayor also, one of the veteran politician who died day before yesterday. So these valuable lives we are losing. So please, all of we are here, please take care of yourself and take necessary measures to step forward of your doing. I really thank Dr. Ayla for taking this initiative. By staying at our home, our workplace, we can communicate the global people like you, and we can share our thoughts. We can make a new communication way or new circle for our exchanging views, which might be in a greater aspect of sharing the views and knowledge. And it will help us, I'm sure this will help us in our coming days to protect and prospect of our future growth. So here I'm closing from my part, and I'm asking Dr. Ayla to put her closing remark over here. Thank you very much.
Thank you, Mr. Ahmedul Islam. Regards from Jakarta, Indonesia. And I think this pandemic has given us a lot of wisdom to restart our life. For me, it is, because actually when I started this conference about 2 months ago, I still don't know what to do, because, you know, all my life I'm in real estate and I'm only selling rental, you know. But after 2 months, I begin to realize a lot of things are bigger than business itself, you know. And actually through a lot of conversation, input from a lot of people, I find out that a lot of business opportunities actually lies in front of me. And a lot of people actually also asking to me, why leadership? You know, I actually finished my professor paper just in pandemic time, something that maybe I cannot do for maybe 10 years or 5 years, you know, because I was sitting just listening and doing qualitative research about a lot of people when they speak, and I begin to have a lot of knowledge, you know, about how people actually behave and how they are actually confronting fear. And actually, it's a lot of positivism in this new world. And I'm blessed because so far we reached, like I said, 30,007 people. We reach Africa, and we actually also have 6 centers that moving along. Like we have wellness center, and that is if the people in Sri Lanka, if you need, we actually providing like wellness center with doctors, and if you want to be a part of it, you are also welcome. We have children center. Well, children have conference every Sunday. That's really interesting. Some children are not going to school for months, and they are still not going to school for months. I actually finding a very tough difficulties. Besides not going out of doing my work, I really have to take care of my 2 active boys, who is very, very active. They just never sit still. So, I mean, children conference is amazing. Like we have a lot of parents like asking us how to enter that, because it's really cute, because children actually moderating. We give like, it's just really cute. So I have conference every day. World Women Leading Change, we have conference every day, you know, every day, like really literally every day, except for Tuesday, Wednesday, and Friday. No, except for Tuesday and Wednesday. Monday we have leadership. Thursday we have leadership. Friday we have a wellness center. Saturday we have education center, and also Saturday we have creative art. And on Sunday we have children conference, and now we have infrastructure. So it's like the whole week of day we have conference. So anybody who wants to join, who wants to be a speaker, or who wants to even host in your country is welcome. This leadership conference, it is already at the end. You know, we will have another 3 more conference, and Datin Malin will host World Women Forum on sometimes on July. So you know, I'm actually feeling grateful that this pandemic have teach me a lot of wisdom, a lot of patience, and a lot of new friends. You know, I've been sitting at home, but I still make a new network for like maybe 30 people a day. So it's been amazing, and I hope Indonesia open. My business is like eventually will be open back, and of course, we hope that for all entire world. And I want to say thank you for the speakers for amazing, insightful information, especially for Bangladesh, who has hosted the event, Mr. Amedul, and the president of WWLC Bangladesh, of course, one and only Datin Malin. Thank you so much. Sending you a lot of love and light from Jakarta. And
thank you.
Yes, I hope that during the pandemic, we actually do something very useful for the world, like giving our even thoughtfulness and knowledge to the world that will be written in the book. And if you all can join me, we're actually planning to give it to Antonio Guterres on 24th of September in New York, United Nations. You know, so it's a book from all of us leaders from around the world about our thought and our knowledge and our wisdom, and of course our science of leadership. That's what I call it. It's called the leadership science, you know. Thank you very much. Love and light from Jakarta, Indonesia.
Thank you, everyone.
Thank you, everyone. Thank you.
Thank you, one.
Thank you, Bangladesh.
Yes.
Thank
Goodbye,
you. But before concluding, I must give a great big thanks to Datin Mallika, who actually moderated very well, and it was totally of our control. And Mallika give a I must say so. Thank you to Datin Mallika, and of course this kind of conference will make our relationship better and better. And we again, I will try to again organize such event in near future. I will ask our ministers time schedule first, and then join them in this very recent issue that will be very interesting.
Yes. My Indonesian ambassador also in Dhaka is ready to speak on your next event. I already contact her, High Excellency Rina. She said if you host a next event, she will come and join. Yeah.
Ayla, I know Rina. I've met Rina before. Please mention my name. People know. Yes. I will also get Her Excellency Maram to join us. I just need a little bit more lead time because sometimes these people are busy. And I will also try to get the His Excellency Bangladesh Ambassador in Malaysia as well to join. I've messaged him, but he said the timing is a little bit off for him. But next round, we'll have more time and we will invite them.
All of you.
Thank you, Amit. Thank you.
Actually, I think Datin Mallika know this is my outfit is the Corona outfit. So my beard is for the Corona. So yeah. So all of you who joined here in this session, thank you very much. And all of you are invited Bangladesh after the Corona.
Thank you.
Thank you. Bye-bye.
Goodbye.
Bye.
Thank you.
Thank you.